we want to go ahead and get started because we do have a lot to cover during our session here today. And I first want to start by introducing myself and thanking you all again for joining our roundtable discussion chat titled Seeing and Hearing Children's Vision Needs. My name is Phil Goglas, and I'm a managing partner at the Health and Medicine Council. I work here in Washington, D.C. On behalf of Prevent Blindness, working on government relations. I work very closely with Sara Brown, Kira Valdonato, and everybody at Prevent Blindness to help advance critical priorities, not only through Congress, but through federal agencies as well. And I am a male with a pinkish red tie and a painting in the background. And I'm very happy to be with all of you today to be your moderator for our discussion, where we will go over the need for and the importance of policy around children's vision and eye health services. For the next 50 minutes, we are going to be hearing from key experts on what the needs are and what the solutions that we are working towards in Congress, and how you can be helpful through the entire process. We are currently in a time where there's just a lot happening here in Washington, so it's very timely that we are having this discussion today, where you can all hear from our experts, and then at the end, hear how you can get more involved and help to advance this critical piece of legislation that we're going to be talking about. Before we get into the discussion, there's just some housekeeping items that I want to touch on. The discussion is being recorded and will be made available on the Prevent Blindness website at preventblindness.org/2024 iSummit presentations, but we will share that link with you so that way you all have access to it. All recordings will be added within a week. And in addition, speaker and moderator bios are available in the Summit Lounge. We will take questions from the audience and we'll respond to as many as time allows. So please submit those through the Q&A button at the bottom of your screen. Now I want to take the opportunity to introduce our panelists who will be with us for the next 50 minutes. First, we have Sara Brown, who is the Director of Government Affairs at Prevent Blindness, Shannon Toulouse, who is the Northeast Regional School Nurse Consultant at Haverhill Public Schools, and Karen Woodhouse, who is a Director at Eyes on Learning. Again, we are going to be taking questions from the audience, and we will respond to as many as time allows. So again, please use that Q&A button. Many of you will probably, as we go through discussion, a question that you are ready to ask will be answered during our back and forth, but please do use that Q&A button to ask those questions. Thank you, Sara, Karen, and Shannon, for being here today. Want to get us started with the discussion. And to do that, I would like each of you to introduce yourselves and share briefly a little about the work you've done around children's vision. So first, I'm going to ask Sara Brown to introduce herself.
Thank you, Phil. Hi, everyone. I'm Sara Brown. I'm Director of Government Affairs with Prevent Blindness. This is a role that I've held for over 7 years. And while my colleagues are in the Chicago area for the most part, I am based in Washington, D.C., as a big part of my job is to have conversations with members of Congress, their staff, federal policymakers, and other organizations that have interest in some of the areas that Prevent Blindness advocates for on a daily basis. And I'm excited to be here today. Want to provide a description of myself. I'm a light-skinned white woman. I have brown hair. Today I'm wearing a green shirt under a black business jacket. My background is the lovely coast of Southwest England. There's some blue sky, some clouds, lots of sea cliffs, a nice white sand beach, and some houses on the cliffside. Please enjoy.
Thank you, Sara. And you are definitely making me jealous because it is incredibly, as you know, hot here in Washington, and I would much rather be somewhere with a white sand beach. Next, I would like Shannon Toulouse to introduce herself to everybody.
Thank you so much, Phil. I am so thrilled to be here. Shannon Toulouse. I am a white woman with long blonde hair, blue eyes. I am wearing a blue short sleeve top with dark rimmed multicolored glasses, and I am in my home office alone. I've been involved in children's vision here in Massachusetts since 2001, when I first was trained by Prevent Blindness, actually as a Head Start nurse, where we conducted vision screenings in our Head Start program for infants and toddlers. And that was many years ago. I won't talk about the outdated technology, but it was kind of fun to do. And since then, I've been involved with children's vision on multiple levels, including work with the Children's Vision Massachusetts Coalition on the leadership team, and also as a trainer and a consultant for school nurses here in Massachusetts who are actually mandated to conduct vision screening programs here in schools. So I provide technical assistance and support for those nurses who are using evidence-based vision screening and also early education programs. Most recently, I joined the National Center for Children's Vision and Eye Health on the expert panel. Thank you.
Thank you, Shannon. And I'm going to now ask Karen Woodhouse to introduce herself.
Morning still to my colleagues in Arizona and to those on the West Coast. And good afternoon to the remainder of the country. Again, my name is Karen Woodhouse. I'm the director of Eyes on Learning, which in Arizona is the statewide vision health initiative. We are a coalition of children's vision partners, advocates, and stakeholders. And we believe that every child should experience their best vision health and learning success. And so we work together to increase and improve and expand the number of kids that are actually receiving vision screening and then getting connected to an eye exam and treatment if needed. And you can learn more about us and our work at eyesonlearning.org. I am a white female with shoulder length brown hair. I'm wearing a blue and white print dress, and my background is actually in my office. I have intentionally blurred it, but I'm here in Arizona and I'm sharing the heat with Phil back in DC. It's hot here in Arizona as well. So delighted to be here and looking forward to the conversation.
Thank you to all of our panelists. And Karen, I think your heat may be a little more bearable if it's dry heat. The humidity here really does make that difference. But to build on some of what you were mentioning, Karen, in your introduction, I think it's going to be helpful for everybody to learn a little bit more about what is being done to support children's vision at the state level to help us on this journey that we're going to be taking. So can you share what your experience has been in Arizona?
Absolutely. Eyes on Learning, the coalition was formed in 2016. So we are 8 years on, and we are actually building on efforts of a lot of dedicated folks that had done some work in Arizona, but we never had the opportunity in those past years to bring everybody together and talk about our shared priorities. We had a lot going on depending upon which organization was taking the lead on something at the moment. So creating this coalition with varied partners within the health, education, community sectors, including public state agencies, businesses, philanthropic partners, it really has allowed us to unite and determine shared priorities, again, toward the improvement of the rate of vision screening, connecting kids to eye care and treatment when it is needed. We talk a lot about the connection between healthy vision and learning success, and especially early literacy acquisition in our state. There aren't any funds, state funds or federal funds for that matter, to support this work. So we've relied and leaned into the support that we've received from philanthropic partners, some businesses, but they've been extremely generous. And that's both a really big success to be able to garner that funding and do the work that we do, as well as still a challenge because we don't have dedicated funding. I happen to be paid by a philanthropy consistently, so that's very beneficial to have that backbone in place. But for the most of our work, it is again, as a coalition, we are relying on the partners to do that work, but it is through the generosity of those funding partners that we're able to be successful. I want to say that we've been able to tap into some federal funds through the Health Resources and Services Administration. The acronym for that is HRSA, and that's what rolls off my tongue for the most part. I never say it out loud, the long name. But for those of you that are familiar, we have, through the benefit of work at the National Center for Children's Vision and Eye Health at Prevent Blindness, we've been able to tap into some of those funds, a little bit of money from Title V, the Maternal and Child Health Grant in our state, but it is very limited. And so we're always looking for the opportunity to increase the amount of funding that we're able to garner to do the work that we're doing. I also can say that Arizona, up until 2019, was one of a handful of states that did not require vision screening in schools. And so we did quite a bit of work to change that. And in 2019, our governor signed off on a new law. Unfortunately, the implementation of that law was delayed because COVID hit very shortly after that. And it just took a while for our state, our health services department, as well as schools to kind of recover from the focus that they had in that area and, the pandemic. So we are proud to say that beginning this upcoming school year, which convenes in about a month here in Arizona, that schools will now be required to follow that law. And so they'll be providing vision screening. Many of them did it before, but the quality and the consistency was, all over the place. So now we've got something very, very consistent, and it will equalize across the state the number of children that have access in their school to vision screening. I'll also just share the fact that we've been able to gain momentum by convening our vision stakeholders in a biennial statewide summit, which also was able to expand the awareness and education of those folks as to what's going on and what we're doing as far as progression, our progress and our success. We've also done a lot of work about expanding awareness and education for families, and we're working right now about how we communicate best with families. I'll give you a clue. Young families communicate by text. They don't want to pick up the phone and they're not reading email. It's about text. So we're doing some work in that area. We've created a regular surveillance system using data sources that we do have, primarily a Medicaid claim database that we've been able to really work on. We have a data dashboard that we frequently look at to guide our decision making. And we've transformed our vision screener certification system into a free system that's available online 24/7 for anybody who wants to access that, and then do a performance assessment to earn their certification and be able to provide the screening under the new law. So I would say one of the gaps that we still have in Arizona is about connecting kids to eye care, closing that gap between kids who are screened and when that shows a problem and getting them into an eye exam. And that's something that we're really working hard on, hopefully to turn that into a success in the next couple of years.
Thank you, Karen. It's great to hear all the good work that's being done there in Arizona. I want to turn to Shannon now to give your perspective as a school nurse in Massachusetts on what is currently working and not working in children's vision. I am going to go out on a limb here and say probably the things that you are going to describe are not limited just to Massachusetts and can be found in other parts of the country as well.
Yeah, exactly, Phil. Thank you. And I've actually taken lots of notes from you, Karen. So we're always learning from each other, which is one of the amazing things about the National Center bringing us together and Prevent Blindness. So, for school nurses in Massachusetts, we are very fortunate to be fairly well resourced. There's always challenges with any group, but in August of 2021, with technical assistance from the Children's Vision Massachusetts Coalition and experts at the National Center for Children's Vision and Eye Health, we were able to update our vision screening guidelines, and we drafted some evidence-based vision screening protocols that were approved by the Department of Public Health here in Massachusetts. And those protocols were disseminated to school nurses who I've already mentioned are required to perform vision screenings in schools and conduct programs in schools, as well as, pediatricians and others who screen children here in Massachusetts. The protocols were developed, primarily through school nurses, for school nurses, but, we want these updated evidence-based protocols to be available to any provider who screens children's vision. So we have reached out to pediatricians and Head Starts and other people. We still have a lot of work to do in that area, but that's one of the things that's really working well for us is now that we do have evidence-based guidelines, now it's really about continuing to disseminate those protocols and train people. I was actually able to focus on the dissemination of the updated guidelines in 2020. I happened to be in a doctoral nursing program, so I took that opportunity to create a project related to the new vision screening protocols. I developed an educational website. I traveled across the state to 6 different regions and provided training, technical assistance, and support, and assistance primarily to school nurses. And, we have this robust statewide regional school nurse consultation program. We're very fortunate here in Massachusetts to have that. There's 8 expert professional nurse consultants that work from funding under the Department of Public Health. And we do provide all school nurses across the state with, any training, but specifically vision screening training, as well as, the hands-on technical assistance and support. So that's available to all the school nurses. So it's easier for us to kind of reach the school nurses because we do have this network of consultants and trainers. The program, as I mentioned, is funded by the Department of Public Health, and it was really key to helping us disseminate the protocols. In addition to that robust consultation and support system, we have a fairly robust school nurse workforce. Just like the regular, I would say, additional clinical settings, school nurses, the workforce is, kind of dwindling, and we have our challenges, but compared to other states, we're really fortunate to have some well-trained and well-supported school nurses. And for this reason, many school nurses are actually able to provide intense case management and care coordination for those kiddos who are not passing school-based vision screenings, and they're able to refer and connect the children and families to comprehensive vision care and then track them through the completion of the referral. Unfortunately, this level of care isn't available at all districts. So that's, kind of leading us into what isn't working here in Massachusetts. And one of the things which is not unlike many areas of the country that we've just discussed is equitable access to care. It remains a concern here in Massachusetts, particularly in the rural parts of our state, like in Western Massachusetts, and certainly for families who are impacted most by social determinants of health. Again, not like other areas of the country, there are these social and structural determinants of health, and they're really causing barriers to the ability of families and children to be able to access comprehensive vision care. Anything from screening all the way up to referral completion and follow-up in care can be impacted. And there's still many children who aren't able to access vision care for, lots of different reasons, including transportation. If the nearest eye care provider is 2 hours away from you and you don't have a car or public transportation, it's really difficult to get to that care. So this means that many children, unfortunately, get lost, to the system. And we don't currently have an adequate way to identify and track children on a state level, kind of a statewide, what we would call like a surveillance system. For those kids who haven't passed a vision screening, no matter where they're screened, whether it's in schools or primary care settings. But that's something that our coalition here in Massachusetts is continuing to advocate for, is some type of a tracking system for those kiddos who are not passing the vision screening. And, so I mentioned the fact that some kiddos are getting lost before they're even getting a comprehensive exam. And it doesn't mean that they're not necessarily getting to care. We're just not tracking them. So we're just not really sure, what the extent of the problem is. So, despite intense care coordination and management by school nurses, Head Start staff, pediatricians, we really just have no idea without this tracking system, kind of what's going on across the state. We need more education for teachers. Karen, you mentioned you have that excellent teaching, so I might be calling on you again. And education, but teachers, parents, caregivers, and others, they really need to know about the impact that poor vision can have on the development of early literacy skills and certainly a child's ability to access their education. We do have strong evidence now about the impact that poor vision can have through the Vision in Preschoolers study and other similar studies, but we really need a better system to engage our partners in education, teachers, early education professionals, as well as caregivers who are most often responsible for getting the kids to the care that they need. So those are some of our challenges, as well as some of the great things going on.
Thank you, Shannon. As everybody has heard from both Karen and Shannon, there's a lot of good work that's being done, but there also is a lot of areas that where things aren't working. And again, it's not limited to Massachusetts. And I really want to hone in on one point that you made, Shannon, and that's the equitable access to care. You know, oftentimes people will think of, and it happens when we do advocacy on the Hill, you know, you think of a state like Massachusetts or New York or California, and you think, well, those are large states, you know, there's a lot of urban areas, they don't have any of these issues. But if you look at rural parts of the state, or even in those urban areas, you may not have that access to quality care. You may not have those qualified medical professionals there. You really do have care deserts throughout the country, and it's not just in a diverse state like Arizona. You know, we see it everywhere. So using sort of that as a background, Sarah, I want to turn to you and discuss the Early Detection of Vision Impairment for Children Act. I know that, you know, you and I have been working on introduction for quite some time, and we're very pleased that we do have a bill. But before we get into, you know, having you explain a little more about the bill and why it's important for our community, I just wanted to share some background with everybody who is not as familiar with sort of the legislative process to level set where we are. So for different policies to be implemented, they have to be passed by both the House and the Senate. So we are very fortunate on the House side to have a bipartisan bill, meaning we have a Republican and a Democrat who are working together to lead this effort on the House side. And that's really important because it puts us above sort of the politics of the day. It makes it a key issue that everybody should be focused on and care about, because it's not a single party issue. We're talking about children across the country. And as we were just mentioning, it doesn't matter if you're in a red state or a blue state, whatever color state you're in, these issues are present, and we know that they are present. So we're very fortunate to have Congressman Gus Bilirakis from Florida and Congressman Mark Vesey from Texas, who are leading our House bill. They've introduced the bill, so we're working on getting additional co-sponsors, and you'll hear a little more about that later on. But that just means we're asking for more people to put their name on and be supportive of the bill. The more co-sponsors we get, the more likely we're able to move it through the legislative process. We are also working on a Senate companion bill, which is going to be the same bill, but in the Senate, because we need a bill to pass both the House and the Senate to be signed by the president into law. So we're halfway there when it comes to Congress. We have a House bill. We are very diligently working on a Senate bill as well. But what really will make the difference in how to advance this is your advocacy. And again, I don't want to get ahead of ourselves. We'll talk about that in a little bit. But I also just want to where we are in the legislative calendar, I'll call it now. You know, it is July. This is an election year. So there's a lot of outside factors that influence sort of what gets done on the House floor and the Senate floor. Right now, they're in the middle of appropriations, so that's deciding how much each federal agency is receiving in funding. And then during the month of August, Congress always takes their summer recess. So they're always gone for the entire month of August. They're not here in DC. They're back home in their districts, which of course we'll come back to that later too, on how you can be involved and connect with them locally. And then they come back for a little bit in September, but then they're out again in October. So we've had this bill introduced in this Congress. We do know that because of a lot of factors out of our control, we want to ensure that we're getting as many co-sponsors as we can. But at the end of this calendar year, this Congress will end. So what we will have to do starting in 2025 with the new Congress is reintroduce the bill, because it'll be a new Congress with a lot of new members in both the House and the Senate. So we'll be working on reintroduction in the new Congress as well. So even though there seems to be a lot of stuff that is going on, and you know, we have a lot of things that we have to navigate, I don't want to understate the importance of having a bill introduced, specifically a bipartisan bill in the House of Representatives. So sort of with that, a little bit of that process as some background. And Sarah, if I missed any part of the process that you want me to highlight, please do fill that in, as we always do when we have sort of these meetings on the Hill, where we just finish each other's sentences and make sure we cover everything But with that as a background, could you walk us all through the bill and why it's so important for our community?
Of course. Thanks, Phil, and thank you for that level setting. It's definitely important to keep in mind. And we here at Prevent Blindness are so excited about the introduction of this bill. Just for everybody's knowledge, the bill number that it's been assigned is HR 8400. So that's 8400. So if you just want to do a quick Google search, the bill text is online. You can get all of that information on congress.gov. And there's also a webpage that is dedicated to the EDV Act, where you can get all sorts of background information, including talking points that can assist you in speaking with legislators and community leaders about the need for this program. So I'll talk a little bit about the bill itself, and just hearing what Karen and Shannon had to say about what they're experiencing in their communities just really continues to underscore the need that this bill is so necessary and very needed. So this legislation would help to improve the vision and eye health of children across the United States. It would do this by providing resources to states and communities through grant funding. Then this can help them establish or improve systems of care for children's vision and eye health, and that is focusing on that early detection and intervention, specifically implementing those models for early detection and intervention for vision screening, referrals to care, and follow-up to eye care treatment for all children that are in school. Not just the, I don't want the early detection part to be a misnomer here. This is for children of all ages. Children's vision continues to grow and change as we, grow through our younger years into our adolescent years, most certainly through middle age and aging. So this is stressing that process of early intervention and detection of vision screenings for kids. So let me talk just a little bit about the specifics of this bill. Like I said, it provides grant resources for states and communities. We are envisioning up to about 10 states right now. So this would be funded at about $5 million per year for grants for states and communities, tribal organizations, and others. They're all specified in the legislative language. And this would be used to fund a number of activities that are also outlined in the bill, ultimately to improve systems of care, implement systems of care, modernize or update some of those practices, but really focusing on that systems of care for children's vision and eye health. As Karen and Shannon both said, and as I think I'm already noticing in the chat, something that is missing very strongly is, you might have a program where there's a vision screening that's implemented at a certain age or a mandate of some kind, something that's offered in a community or home or medical setting. But what often is missing after that is that follow-up to care. So identifying why a parent or a family was not able to get their child to an eye care provider, and looking at ways and strategies to focus on that barrier, that challenge, and address them. Not just say, well, your child got a vision screening and everything's fine. They seem to be doing okay, but actually making sure that they do follow up on that failed vision screening to ultimately get to diagnosis and treatment and make sure that they adhere to that treatment, because we don't want kids to go through school and life and all of their development processes, whether that's socially, emotionally, physiologically, or others, with a vision problem that could very well easily be addressed the earlier that it's caught. So this would really provide states with the capacity to be able to implement those systems of care. A lot of states are able to do a little bit more than others. But as we were talking about already, there is such inequities within children's vision and eye health, and not every state can do things, and not every state can do things the same way. We just came out of a major public health crisis, and with that came other crises, including substance abuse, mental health, and behavioral challenges, as well as others. These are all things that states need to respond to, so they don't always have the capacity to be able to implement some of these strategies on the ground. So this funding is really important to give them the capacity. Think of it like a little bit of a capital injection to be able to do things and actually use that funding in a more dedicated manner and than what they're doing right now, ultimately to improve access to eye care and also eye health outcomes across the country. The second thing that this bill does is that implements a technical assistance resource center for states, and this would be housed at the CDC. If I failed to mention earlier, the grant funding would be allocated out of the Maternal and Child Health Bureau at HRSA, Health Resources and Services Administration. So if you hear me say MCHB HRSA, that's what I'm talking about. But the Technical Assistance Center would be located at the Centers for Disease Control and Prevention, or CDC. This would be available for states who do or do not receive grant funding. So if states missed out on that first round of grant funding, which would be a competitive process, they would still be able to access some resources so that they can do something to improve children's vision and eye health, whether that's looking to update some of the screening protocols, how to train vision screeners, looking at school nursing practices, just anything that they would have available. Our National Center for Children's Vision and Eye Health at Prevent Blindness already does this work, and my colleagues are tremendous at what they do. But the need is very, very great. And so we want to make sure that that is elevated to the national level so that all states can continue to access this information and do so in a timely manner. And the third thing that this bill does is to encourage the Secretary of HHS and Department of Education to actually talk to each other. What a novel concept. But we really, really felt that it would be a disservice to what we're trying to accomplish if we didn't have these two agencies actually speaking together, working together, and collaborating on children's vision. You know, as we're kind of seeing things right now, children's vision is, you know, here and there as far as federal approaches and programs for children's vision and for other health programs, but it's kind of been on the margins of a lot of major programs. And as Karen mentioned too, you know, the work that she's doing, Shannon as well, it's kind of, you know, being pieced together by various funding sources. And we need to put a stop to that. We're kind of already seeing a lot of federal interventions and funding for a number of other children's health issues, as we should. We should invest in our children. They are the future of this country, but we don't see anything for children's vision and eye health specifically. And so this legislation would change that. And so we're so excited about this bill. To Phil's point about the bipartisan nature of this bill, you know, we know that the need has been long existent, and we could have, as an organization, worked with Congress to introduce this legislation a long time ago. But it was really a goal for Prevent Blindness, and really something that was more of a guiding light in our, you know, intention for how we get this bill introduced, to have it be bipartisan. We want something that really kind of withstands those political winds. They do tend to blow through DC quite a bit, but we want to make sure also that the legislation that we have enjoys strong public support and eventually has a really strong foothold in the rubric of children's health programs that we see at the federal level.
Thanks, Sarah, for that comprehensive background on the bill. I think, you know, you and I know this bill in and out as we've been working on it for quite some time, but I think it would be helpful for everybody to know why we took this approach. So could you go into why we took this path for the EDV Act for children's vision?
Of course. So you might be wondering, you know, why we're calling it the EDV when it's called the Early Hearing Detection and Intervention Vision Impairments for Children. So there's a little bit of a C. We actually shortened that, the name of the bill and what we're calling it on purpose. Those of you out there may have heard of a program called the Early Hearing Detection and Intervention Program, or the EDI program. And so we're hoping that the legislation that we have will sort of be a twin program, so EDI and EDV kind of working together. But really, you know, when we took to the drawing board a long time ago to look at, you know, what kind of legislation can we draw up that can pass and that can be a really strong program, we took a look at a lot of other public health programs that are currently in existence right now and have continued to work. And the EDI program was one that really caught our attention. There's a lot of differences that our colleagues in the hearing side of things can tell us about vision, but early detection of hearing impairments for children is also incredibly important to help them not only be able to hear things around them, but to be able to speak and communicate with others. And so a long time ago, about maybe 20 or so years ago, Congressman Michael Bilirakis, who was the father of Congressman Gus Bilirakis, who champions our bill on the Republican side in this Congress, was actually the pioneer of the EDI program. So 1999, let's go back to that time. At that time, only about 10% of infants in our country were being screened for early hearing disorders and then referred to audiological care. So 10% of kids in this country are actually getting the audiological care that they needed. Fast forward to the EDI program, which is very similar to what EDV does by creating those grants for states, technical assistance, and then you know, recommending surveillance and best practices for professionals. Fast forward to about 2018, the best data that we've seen at this point shows that that 10% number is now 98%. So this, in other words, 98% of children in our country under 6 months of age are being are actually receiving specialty audiological care and actually being referred to care. So this is a program that has been tremendously successful, and it continues to receive bipartisan support. It continues to be reauthorized. That program now, just to kind of contrast with where our bill is, which is at 10 million per year over 5 years, EDDI is now being funded at about 18 million per year with grants to states and communities. And I believe that's about 53 are receiving that grant funding. Hopefully we'll see that same success with EDV, but also 10 million at the CDC to help with surveillance efforts and to help states to collect data and to add that to some of their own systems. So market success, we definitely have been stressing to that point with members of Congress that, this program has worked. It continues to receive that bipartisan support. And we definitely think that that approach has worked for hearing and that it could work for vision screening as well.
Thanks, Sarah. I know that we have so much more that we want to cover in this discussion, but we are going to be running out of time. So I do encourage everybody to join our chat session that we have after this presentation, where all the panelists and I will be there to answer some questions and can touch upon some of these points a little bit further. But while we still are here, Karen, I just wanted to go back to you and get some more from Arizona. From the Arizona example, what do you feel can be translated into action at other states or even the national level? What can we learn from Arizona that can be replicated across the country?
Here we go. So I'm going to just briefly mention 3 things that I think have helped kind of webbed our infrastructure. And without that infrastructure, I don't believe we would be able to be doing the things that we're focusing on in our priority areas. So one is obviously having a coalition of partners, and it's a multi-sector coalition. There was a session this morning that talked about, paying the people that serve on such, kind of a coalition. It was related, I think it was part of some work at Yale University. And we're not there yet, although we have provided stipends to some of our parent representatives in some of the work that we've done. And I think that was really crucial, not only to engage parents and family representatives, family leaders in our work and our decision-making, but also to highlight how important their voice is. And so to be able to provide a stipend to them, I think went a long way. Our strategic plan is 1 page. It's a legal size page, I'll admit that, but it's 1 page. And so it's easy to see what it is we're about, where we focus, and what we want our outcomes to be. So being very clear to people on why you are engaging these partners together in our coalition and wanting their leadership and insights. They contribute a rich pot of expertise and ideas. And without them, we would not be doing the work that we're doing. Secondly, we've talked about how EDV is going to help us with surveillance and coming from a national perspective. I think that's so critical. Shannon also has talked about, the use of data, the need for data. And so however we can get it and what sources there are that are good, that we can use, it helps to be able to tell the story and bring it home. So you can talk about a family and what they've gone through, and then talk about what the data has told us about how many of those families actually exist in our state or wherever we are. So we've also worked with higher ed. They've been great partners, and they've done it as cheaply as they possibly could and still got us a great product. And we found out a lot of information. We've done a study on the network adequacy of our eye care providers in Arizona. We've also done market research on parents want to receive and why they aren't. What is.
So we're losing Karen's internet. I think it's happening for everybody as well. So Shannon, I'm going to ask you the same question about what you would like to see that has been accomplished in Massachusetts, replicated by other states, and if there's a role for national support. Karen, your internet cut out a bit, so we'll come back to you. I just pose the same question to Shannon.
Yeah, thank you, Phil. And, very similar to what Karen had mentioned, really so much of our success has been that broad-based multidisciplinary coalition that we also continue to have. The coalition was formed in 2009. It was actually funded by Prevent Blindness and some MCHB, Maternal Child Health Bureau funding. Unfortunately, it ended in 2021, but we have been able to keep our coalition leadership team together, and we continue to engage. We actually advocated for a Children's Vision Commission that was formed. It was legislatively formed and worked closely and led that by the Department of Public Health. And we were able to study like what is happening in children's vision here in Massachusetts. And unfortunately, or fortunately, what we found was we didn't have a lot of data. So we didn't have the data and the stories that we needed to talk to people about what was happening and what needed to change. So the coalition, the commission rather, was legislatively commissioned. As I mentioned, we had 6 key recommendations that were part of a report that we provided to the legislation in 2019, and we know what happened across the world shortly after that. So we do still continue to advocate for some of those changes, and we're actually have been able to keep up that momentum and engage with key leadership at the Department of Public Health to really keep those recommendations at the forefront. And so we have a lot of strong Department of Public Health, successes and good relationships with them. So that's really giving us a lot of hope that we're going to be able to make something happen. But, we know that we can't do a lot without the funding and the support and the data that we need. So we're still going to work on it.
Thanks, Shannon. And Karen, I'm going to come back to you to finish that previous response, but I want to add a quick question to that as well. You have received federal funding for children's vision in Arizona in the past. In addition to finishing your answer from the previous, if you could just share what that impact has had on your work there in Arizona.
Sure. It has allowed us to really coalesce around what our shared priorities are. It allowed us to bring together partners, including parent and family leaders, to let us know from their perspective what is important. And we've been able to, one of the key questions that we're trying to figure out is how do we connect kids from vision screening that shows a problem to eye care? So I would say that without the National Center helping to originate those opportunities for us to bring together stakeholders and really formulate and formalize where our priorities are, we wouldn't, be in the place that we are right now. So even though it's a small amount of money, it was able to go a long way, and we got great results from it. I would say that just to finish up my thought before the internet squeaked out, it was about data and surveillance and how EDV is going to be a key opportunity for us to look at that from a national perspective, and that filters down to each of the state levels. So I'm quite excited about that aspect. I think it helps to back up your family story or the stories of what's going on in your state with key stakeholders that can make decisions to be beneficial for kids' vision with data to let them know what the real picture is.
Thanks, Karen. And that perfectly dovetails into the next question I have for both you and Shannon. If your state, Arizona, and Massachusetts receive funding from the EDV Act in the future, how could you see this money helping children's vision? Karen, I'm going to start with you in Arizona, how it would help.
Yeah, as I've mentioned a couple of times, one of our key priorities right now is how can we connect kids from a vision screening that shows a problem into eye care. And so having a funding source that allows us to do that on scale. Right now, we have a couple of projects and some partners that are doing great work, but it is very localized and it's small. I mean, we're impacting kids, but we have so many more kids that we need to impact. And so being able to have a resource that allows us, again, to broaden that at scale and do some great case management and work with families to make sure that they understand, have the resources that they need and the support that they need to connect that child to eye care would be great. We are focusing on 2 areas in addition to working with families on their understanding. One is to increase the number and geographies of Medicaid certified providers so that we can make sure that kids in Medicaid who are covered can have access to an eye care provider. And secondly, bringing more mobile opportunities to school sites. We know that for some families, that is a great answer for them, so that they're not having to worry about the transportation aspect or connecting somehow. The mobile eye care is right there on school site, and we've had a lot of success and families really willing to participate in those kinds of projects. So that's where I think the grant money and the opportunities from EDV could be really beneficial.
Thanks, Karen. Shannon, I'll pose the same question to you.
Yeah, thank you. So, we know that building this comprehensive system of vision care that we would like to see here in Massachusetts is going to take time and personnel with expertise in children's vision. We're going to need to continue our strategic partnerships and, of course, funding. So that's how I think the funding would help, is to help us build that comprehensive data and to look at the data and actually see what's going on. So the funding would allow us to, if we had more data and more comprehensive information, we could advocate for that large scale system change that we really know that we need. Understanding what's happening is going to be a great first step. And so, for example, I think Karen mentioned this too, like which children are getting screened with and where, which children are going on to access comprehensive eye exam and follow-up care and which are not. And as I mentioned previously, the social and structural determinants of health, are causing these multiple barriers for children and families across the state. And so what's the extent of the barriers and who is impacted the most isn't really entirely clear. So if we had the funding that we could use to build up that data system and perhaps a surveillance system, we'd really be able to take a look at that large scale system change that we really need.
Thanks, Shannon. Thanks, Karen. In the few minutes we have left, I just want to pose a question to all three of our panelists. What can those listening today and others do to help the EDV Act move forward? Shannon, I'll ask you first.
Sure. So, we are fortunate to keep our coalition going here in Massachusetts, but even if you don't have a coalition in your state, your individual voice matters for sure. Your voices are powerful. Your legislators want to hear from you. Call, write, visit your state senators, your representatives, inform them of what's happening in your state or maybe what's not happening in your state and how EDV Act would help change that. Right. So stories matter. Share your stories, the stories of maybe children that you serve, even if those children are not your own. If you're a school nurse or another professional or a person who's working with children, share your stories of how your vision has impacted their learning or other things. Children need us to do something now. We know how children's vision develops when they're young. And so they're not going to wait. They're not going to wait for us to get this right as adults. I can't even imagine what my path would be if I didn't have adults in my life that could help identify that I had a vision problem. I have corrective lenses on right now. I have a condition called myopia, and it was life-changing to put those glasses on. So I want every child who needs glasses to be able to have access to care, and so that they can my experience and my story is what gives me the passion to do this work and help sustain us, because the work is hard, as you guys know, down there in Washington, D.C. When you see how access to equitable care can change the entire trajectory of a child's life, there's little that will stop you really from advocating for that change. And I was a communications and a major before, and Margaret Mead is one of my favorite quotes. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. I love to live by those words, and I think that any of us can do the same thing.
Thanks, Shannon. We are coming up on time, so I just want to again plug our chat session that we are going to be migrating to in a minute. I also do want to first, before we do run out of time, thank you to today's panelists. Anybody who put a question in the Q&A section, we will be answering that in the chat session that's coming next. But I do want to thank all of our panelists for being here with us today. The link for the chat session has been shared. We ask everybody to join us if you're able to, and to join the next session in the summit, which is the 2024 Prevent Blindness Rising Visionary Awardee. The session begins at 3:55 p.m. Eastern. So you do have some time to explore the exhibit hall, download information from the event sponsors as well. Email communications are available with exhibit staff. Some booths will have video and text chat options available. In addition, feel free to visit our lounge, on-demand video library, or network with other attendees through chat or video. I don't know if they're going to cut us right at 3:40 since we're there now, but Karen and Sarah want to turn it over to you guys to give some of that response to that last question before we migrate over to our chat session.
Sarah, why don't you go ahead?
Thanks. I think the best thing that I can encourage everybody to do is to send an action alert to members of Congress. You can go online to the Prevent Blindness Legislative Action Center. You don't need to know everything about the bill, I promise. You don't need to be an expert. There's already a message that's pre-written for you. So just please go take a few minutes and click that send button. If you have a story, you can customize that message. More than welcome to do that. But we really do need everybody to engage in broad, persistent, and widespread grassroots action. So definitely encourage everybody to do that as a takeaway from this session.
Great. Karen, is there anything you wanted to add? I've been told by the powers that be we can go over by a minute or two, so I want to take the opportunity while we have it.
Okay, that's great. I would definitely tag on to what Shannon and Sarah said, and I would share my story. I can't formally advocate. My funding source is a charitable trust that can't allow that, but I can inform and educate, and I can tell stories. And that is, to me, one of the most effective ways that you can help somebody understand how important it is that we identify early kids with any vision problems and connect them to eye care. So if you feel like you're not able to formally be in that advocate position, there are plenty of ways that you can definitely make a difference.
Great, and I'll just add that everybody's voice does matter. The one question that Sarah and I always get when we go into a House office, there's 435 House members, 100 senators. Every time we go into one of those offices and we talk about EDV or we talk about any other priority, one question we always get asked is, how does this affect my district? How does this affect my state? Is there somebody who can reach out who is a constituent of mine to really hone in on the importance locally? So having this grassroots network across the country, you know, having people in Massachusetts and Florida and Texas and California, Alaska, Hawaii, wherever, reaching out and engaging with their elected officials, that really does make the difference. Sarah and I are very busy here in Washington meeting with members of Congress, educating them about the importance of the bill, what the challenges that we've heard today are, the possible solutions for them. But again, that one thing that always comes up is, does this affect me locally with my constituents? So as Sarah mentioned, I encourage all of you to visit our webpage that has all of these action alerts and all this other information already set. We just ask you to customize it with a little bit of your story, but all the technical jargon DC speak is already done for you there. So all you have to do is follow the prompt there. I do know we are going to get cut off here, so I want to say again, thank you to our panelists, Sarah, Shannon, and Karen, for your time today, for your expertise.